Hi Mama, welcome back. I'm Dr. Emily, physician, mom, and your companion in this beautiful pregnancy journey. If you're new here, don't forget to check the description below for a list of pregnancy-safe products I truly recommend, all designed to make your journey easier and more comfortable. Today let's talk about something every pregnant woman should be aware of, something that often sounds scary when first heard, a low-lying placenta. First of all, what is a low-lying placenta? During pregnancy, your placenta develops inside your uterus to provide oxygen and nutrients to your growing baby. In most cases, the placenta attaches high up on the uterine wall, but sometimes, especially early in pregnancy, it implants lower down, closer to the cervix. This is what we call a low-lying placenta. Now, if you've been told you have one, take a breath. In most cases, this isn't dangerous, and it often resolves on its own. As the uterus grows, the placenta typically moves up and away from the cervix. This is why most low-lying placenta cases diagnosed in the second trimester look completely normal by the third trimester. But when it stays low later in pregnancy, especially if it's covering or touching the cervix, that's when we start monitoring more closely. This can lead to a condition called placenta previa, and that's when there's a higher risk for bleeding, especially during labor. So how do you know if you have a low-lying placenta? Most often, it's picked up during a routine ultrasound around 18 to 20 weeks. If it's found, your doctor will usually schedule follow-up scans to monitor its position as your pregnancy progresses. If you do have a low-lying placenta later in pregnancy, here are a few things you might be advised to do. Avoid heavy lifting, intense exercise, and sexual intercourse if your doctor recommends pelvic rest. Be aware of symptoms like painless bleeding, especially in the third trimester, and seek medical attention right away if it happens. Your care team will plan your delivery based on the placenta's final position, and in some cases, a C-section might be the safest route if the placenta doesn't move away from the cervix. But Mama, here's the good news. In most cases, your body does exactly what it's supposed to do. The placenta rises as the uterus grows, and you go on to have a healthy pregnancy and delivery. This is why keeping up with your prenatal appointments and ultrasound checkups is so important, so we can track everything and act when needed. It's natural to feel nervous when you hear terms like low-lying placenta, but remember, knowledge is power, and you're not alone. You have a team of professionals and me walking with you every step of the way. If you've been diagnosed with a low-lying placenta, or if you have any questions about your experience, feel free to share in the comments. And don't forget to check out the Trusted Baby Essentials linked below. They've helped so many moms feel more prepared and confident. You've got this, Mama. I'll see you in the next video.